to incorporate it all first. Okay? Remember that once you get everything incorporated, then you want to use that stroking technique, right? So you're going to mix like with the side of the bowl. You don't want to stay mixing like witch's brew, okay? So right against the side of the bowl, so you get that nice creamy consistency. You're going to gather it all up. How many increments for the mandible?
2.
Right. From which surface? So 2 from the lingual. With the large trays, you're going to need every bit of your material. When you do this on a live patient, use a smaller or medium, you might have a little more excess, okay? So I have that. I'm going to dip my finger in some water to put the indentation, right? And then I'm going to take a little bit of excess and put it over their occlusal. You want to make sure that the posterior is not overloaded. I'm going to have explained the procedure to my patient. So I'm going to center this over their arch, center muscle mold as I bring it down in the anterior, okay? I'm going to ask the patient to lift their tongue to the roof of the mouth, swing their tongue left to right, and then just have them relax their tongue, okay? So now again, I'm not pushing anymore. My fingers are just there for guidance. I have my index fingers over the tray and the thumbs like underneath the chin. And it's obviously going to take a little bit longer to set here where we don't have that steamy 98.6 degrees of this patient's mouth. Now, before I put the trays in, you want to make sure you explain to the patient that it just might feel a little bit full, might feel a little cold. It doesn't really have much of a taste at all, okay? And that they should just breathe through the nose, and it's going to set relatively quick. So you might tell a little bit of a white line. If they started to like have their eyes were watering, or they look like you could tell they're swallowing, or their eyes are getting big, what would I do? I'm going to ask them to tuck their chin in towards their chest, right? And you want to make sure that your patient is seated upright. So your patient shouldn't be reclined back at all. They should always be in the upright position when you're taking impressions, okay? You want to make sure you don't have your patient too high. That way you're not overextending, right? What word would we never say? Right, because what's going to happen? They're going to, as soon as you say gag, they're going to be convinced that they're going to gag and they're going to die. Right? It's over. When you're doing this on each other, something that happens often is you guys are obviously comfortable with each other, so you tend to joke and laugh. Do you think that's dangerous?
Yeah.
Why? Right, because you could aspirate it, and you don't want alginate in your lungs, okay? And that's just about set. I'm just going to give it another second or so. Now, your impressions on your patient are usually better quality than what we get on the mannequin because they have an actual vestibule that's warm. So they're going to stop the material from flowing and increase the setting time. Okay, you know here it tends to leak out a little bit more because we don't have that. We should invent typodots with temperature.
Mm-hmm.
You could turn on like a heated blanket.
And you could do water.
Yes.
Like
Oh, we're gonna. One of these days we're gonna actually follow through with one of these.
Yeah.
Things. All right. So we're going because look what happens otherwise.
Mm-hmm.
Okay. So I'm gonna get ready to remove. So I'm gonna let the patient know, like hashtag dental beat.
Yeah.
That'll be a
We're dying to come up with a product. You gotta like this is like an all the time thing.
every year. We're
Yeah.
like, this is the product. We need
Last
to-
year's it was a bleeding
Yes, I still do want
bleeding
that, too.
tissue.
I do want bleeding tissue.
Yeah.
I really do. All right. Okay. So, because we suture on like towels.
It could
and
all be
stuff.
the
I
same
don't-
model. Think
What?
about it. The bleeding. Okay.
Yeah,
We'll
yeah.
discuss
Either
later.
the blood or the water in it.
Yes.
Oh, we need to find somebody that can make this happen, come to fruition. Okay, so we're gonna get ready to move, because he's been sitting with this in his mouth for about 20 minutes. So what are we gonna let him know before I remove?
You're gonna hear a snap.
Yep, he might feel a snap, feel a little bit of suction, okay? So I'm going to make sure you're protecting the opposing arch. I have my thumb underneath the handle. I'm going to do a quick snap up, and if it doesn't release, you're gonna use your index finger on the opposite hand to help break the seal. Unfortunately, this patient can dislocate his jaw for fun, so. You're gonna come out at an angle, and then you're going to inspect your impression, okay? So you wanna make sure that you have the teeth, that you have the vestibule, that you don't see any blue. What happens if I see blue when I look at the teeth? We pushed too hard, right? We overseeded it, okay? So we don't see any of that. You wanna make sure that your anterior isn't scraped, so sometimes in the anterior, if you're too close, or if the tray is too small, that will happen in the anterior, that it will scrape. Okay, so you want to check all of those things, all right? Putting the material over the occlusals helps to get a nice, accurate impression of those, and this came out pretty good. Okay, what do I do with it now?
Spray it and rinse it and spray it.
Right, so I would rinse it, right? So I'm going to go to my imaginary sink over here. We're going to rinse it. I have my bag set up. I'm going to put it in my bag. I'm going to slip a glove off so that I don't contaminate this if you don't have a second assistant. And I'm going to spray in my bag. I'm going to slip this back on. And we know that alginate likes 100% relative humidity. So we're going to wrap this in a damp, not soaking wet paper towel, because if it's too wet, what's going to happen? What could happen? Imbibition, right? Could take in some of that and it's going to expand. Okay? So one impression done. Okay? Now I'm going to move that bowl out of the side, off to the side. I'm going to get ready for my second.